Welcome, everyone. My name is Karin Hehenberger. I'm the CEO of Lyfebulb, and welcome to this educational seminar series in partnership with CSL Bering. Today, we are going to focus on how to prevent and treat complications beyond rejection in the transplant space. I'm really happy to have with me today 3 experts from 3 different fields, and I believe that the conversation today will be very healthy and constructive. We also have a number of questions that have been pre-submitted, but we also welcome questions during the seminar from our audience. So thank you to those who are listening live, and of course this is a recorded session, so you can also listen to the archive session in the future. So I'm going to start by introducing our patient representative, Sam Day, who is a transplant recipient, and I'm going to let you speak momentarily, who has a heart transplant and is also a Lyfebulb champion, but does advocacy beyond that. And we have our nurse practitioner, Maxine Morris, who has an important role with the Columbia Presbyterian in managing the transplant patients and beyond. And of course, Dr. Hilda Fernandez, who is also a Columbia Presbyterian and nephrologist by specialty training. So I'd like you to just say a few words on your background and maybe just a sentence or 2 on this specific topic, what you'd like to get out of this session today. We start with Sam.
Thank you, Karin. So nice to be here. Welcome everyone out there. So as Karin mentioned, I am a heart recipient, extremely lucky, completely blessed, and eternally grateful heart recipient from in April of 2015. So it's been just over 7 years, and I have been through some non-rejection type complications. So, but I'm happy to answer questions. So I'm glad to be here, and over to whoever's next, Hilda or Maxine. Thank you.
And we do Maxine.
My name is Maxine Morris. I am one of the kidney transplant coordinators. I have been with the department for just over 9 years. What I would like everyone to take away from this evening is the importance of keeping in touch with your coordinator. That is so important.
Thank you, Maxine. Dr. Fernandez, Hilda.
Good evening, everyone. So I want to thank you again for inviting me. And I think that as a pediatric and adult transplant nephrologist, we've had the experience of seeing a lot of different complications after transplant that I have tried to counsel patients about prior to transplant, but I think that it's not a reality until you're actually experiencing it. So having a conversation about whatever it is that you're experiencing after your transplant is going to be very important, having that open communication, as Maxine has highlighted.
Thank you. And these are great takeaways already from the beginning. We're going to come back to each of you at the end and see if there's anything additional that we can learn and what we can teach. But going back to you, Hilda, Dr. Fernandez, what are some of the complications that you are seeing from a early stage and then going through? Because transplant, of course, is a very long and chronic process. Let's not maybe focus on the surgical complications to start with, because we do have medical doctors here, or you're a nephrologist, and think about the medical complications more, but also the mental, psychological ones. If you want to take us through that process, and then we can ask Maxine and Sam to fill in.
I think it would be great to get both Maxine and Sam's feedback. What I think is important to know is that the medications that we use for transplant can cause certain benefits, right? We keep your transplant longer, prevents rejection, but there are specific side effects to all these medications that we have to keep an eye out for. Specifically, mycophenolate, which can cause diarrhea, gastrointestinal issues, and we're aware of that, and monitor for that, and may adjust your medications as a result of that. So again, letting us know when you have those issues is important, because that can actually affect your overall health. And in addition, one of the medications that we use quite commonly in solid organ transplant is tacrolimus. Sometimes we use cyclosporin, depending on how people tolerate either of those. And the reason I say tolerate is some people get tremors and it gets to a point where it's very bothersome. So that is something that we monitor for. In addition, some people do have some heightened anxiety with the medication, also something to be aware of, and know that it's there and that we have to figure out how best to manage that. These medications also can predispose some patients to having hyperglycemia and post-transplant diabetes. So those are some things that are also common things that we see after transplant, particularly in people that already had a predisposition, and certainly those that already had diabetes prior to transplant. So that's going to be something to monitor as well. And then, beyond that, I think it's taking the medications on a regular basis can lead to some anxiety, making sure that you're taking your meds appropriately and being on top of it. So I've seen patients just, be very cautious about missing doses.
One thing you said, and I want to ask Sam about this as well, is that, and this is an important one, when you said that one of the medications, mycophenolate, may cause diarrhea and gastrointestinal issues, and that per se can cause issues for the transplant patient. Right. What kind of issues are you referring to there? Is that
so diarrhea itself can actually alter your medication levels, both the tacrolimus and the calcineurin inhibitor, and in turn can cause damage to your kidney if it's elevated for a period of time. So being aware that can affect your levels, getting your levels checked is important.
From a patient perspective, and you've now 7 years out, Sam, and also from you, also knowing you're a champion and someone who listens to a number of patients on TransplantLyfe and other places, what are you hearing are the most important complications that people are bothered by?
Yeah, so definitely, like Dr. Fernandez mentioned, the diabetes is a big thing. It affects other things like neuropathy and stuff like that happens. And of course, if you miss doses or if you miss your insulin, and I dealt with that before, so I'm still diabetic. It definitely, if you have a reason to go to the ER, it's complicated because you already have diabetes plus a transplant. And we have to remember transplant is not a fix, right? It's a treatment. So a lot of people, whatever happened before could happen again, so we have to be extremely conscious and talk to Maxine and people like that, transplant coordinator, especially when you're fresh transplantee, you've got to do that, even if it's the smallest thing, right? There's no small question, there's no silly question. I mean, I'm sure Maxine will tell you she's heard the smallest of things, but it's worth it, so there could be many things, Karin, but I'm just saying diabetes happens to be a big thing and like stomach issues and stuff, absolutely. Blood pressure issues and stress is a big thing. Got to be able to manage that stress because that'll just throw everything into a tizzy. But
Maxine, you being essentially the quarterback, for many of these patients, and when they seek you out and other coordinators, how do you, I don't want to use the word turf, but how do you triage them, in the right way? How do you make a decision? This is really serious. This I can handle. This is what are some of the big caveats that you notice?
A lot of it comes from experience over time. Some of the questions and concerns can be the same, although you still have to individualize it for each patient. But again, if there's something that we cannot answer, we always have Dr. Fernandez and the other physicians that we can reach out to and let them know, what the patient issue is. But, like Sam said, and I cannot say this more over and over again, no question is a stupid question. Don't take anything for granted. You have to reach out to us. If it's something that's, not too concerning, we think it's okay, then that's fine. We'll let you know that. But then at the same time, if it's something that needs intervention, we'll make the arrangements for that right away. We'll take the appropriate action, to get things started. But you have to reach out to us. It's a must.
So, Dr. Fernandez, I think the way I see it, and I kind of look at things in decision trees a lot because I'm that kind of thinker. There are some of the complications that are essentially handled by prevention, right? I mean, because as a physician and as a coordinator, you are setting the patient up in the beginning to be doing visits with maybe other physicians or other nurses for certain, for example, skin cancer or
Exactly.
So how would you section those up? What are the things that you think can be prevented, and what are the things that are more spontaneous that you have to handle through these calls?
So we do have recommendations in regards to follow up with your depending on what's going on, your regular cancer screening, because fortunately, one of the things that we know is that medications that help prevent rejection can also make it harder for you to fight off cancer. So certainly going to see your dermatologist at least every couple of years, if not every year, depending on your risk factors, because the medications make it easier for you to develop skin cancer, getting your regular mammograms, getting your regular pap smears, getting that colonoscopy on a regular basis. Those are all still going to be the same. And maybe even more important because you are on these medications that decrease your body's ability to fight off cancers. In addition, you mentioned things that we do on a routine basis during our clinic visits. The medications also make it harder for you to fight off certain infections, particularly during that first year after the transplant. You've gotten such a big immunosuppressive load in order to prevent acute rejection. You're at higher risk for certain viremias. So that's something else that we're keeping an eye on during our regular visits to make sure that those things don't pop up. They may be subclinical. You may not have any side effects to it at the time, but those things can eventually accumulate, and if we don't address them, they can be detrimental to people's health.
That's great. Sam, one of the you mentioned stress, and I think we heard that from both Dr. Fernandez and Maxine as well. The stress for the patient someone said it's not a fix, it's a treatment. Transplant is a treatment and a continued treatment that is chronic. How do you keep patients from not spiraling when they hear about skin cancer, they hear about breast cancer, they hear about infections? What do you do when you speak to your fellow patients?
Yeah, so after transplant, the main concern is rejection for patients. But, beyond that, you got to be aware of everything, like Dr. Fernandez was saying. Do the research. What I tell people is you've got to still educate yourselves, and check with the transplant team, anything that you need to, be informed about. Skin cancer, the risks are higher, the kidney damage, all of those things because of the meds we're on to save our lives, right? It's just weird. We have to take these meds to save our lives, but they cause major impact down the road, So all I say is just be aware of we know our body's the best, So if there's anything, like for me, I can relate a quick example. I had severe pain in my legs, and I'm a guy. I didn't want to go to the hospital. Plus, after the transplant, I don't like to go to a hospital.
Yeah.
But, because I was in the hospital for 7 months and it was just what it was, So, but after the transplant, I didn't want to go, but my wife insisted I got to go. I got to inform the team, ended up going to urgent care. When they see the word transplant, they say, go to ER, right? So when I go to the ER, you do the weight and everything else, but it turns out, they said it's cellulitis, and which is, it's a bacterial thing, and it could happen. And even with the smallest little, I might have stepped on something. I might not have seen the cut or whatever. So you got to be aware of everything, and we're human. So we'll miss stuff, or we'll, deflect things or deny it, but we got to just go with what your gut and always rely on the transplant team's opinion. So Karin, there's not much we can do except be informed and be aware.
Yeah, I always I always see it as a transplant patient, and someone who's been in the system for a while. It's almost like a very fine-tuned sports car.
Right.
It can be excellent, but it has a lot of different things going on. And
don't take it for granted. You
got to be attentive to all those little things.
Exactly.
Versus
don't take it
having,
for granted.
Yeah, because they can go very wrong if you don't.
For cellulitis, I could have actually died. I mean, if I waited too long or whatever, it could go into other things, complications. we don't want to do that. We don't want to do it as early as possible. Even if it's COVID stuff, you got to do it as early as possible.
Yeah, one of our audience members brought up a very good point, and I think that's kind of what you're saying, Sam, was that after those 7 months and you being so sick and needing a heart, and this, the kidney, you're on dialysis maybe for years or in kidney failure, and now you're feeling so much better with the transplant that you just don't want to go back to that situation again. So one of our audience members is saying, life seems so normal. What are the signs I should be looking for? What drives me back? What should I take seriously? And your answer, Sam, is, it's your gut feeling, but maybe, Dr. Fernandez and Maxine, are there any other hints that you should be more cautious? You should just go and as soon as there's a problem.
I would say a couple of things. I think what Sam said about being honest with yourself and trying to not deflect is difficult. I think that particularly when you've been chronically ill, the last thing you want to do is go back to see the doctor again and learn something else is going on. However, certain things that we watch out for are low-grade fevers, sweats at night, weight loss that's unintended. I mean, you could be feeling great and then, well, I've been having this cough for a while. It's fine, I'm okay, but you should get that checked out. That's part of the purpose too, that we have these regular visits, because sometimes we're so busy with catching up with our lives that we don't take the time to stop and address these things.
Yeah, that's a good point.
Yeah, and sometimes those tweaks and stuff, right? Those are necessary, right? So if we ignore those, you just make the problem worse, so got to deal with it up front.
Mm-hmm. So one way of maybe keeping track and keeping yourself honest is to record your symptoms. I mean, is that something that you recommend, keeping a logbook? On TransplantLyfe, actually, we do have a tracker, a data tracker. It could be improved, but at least it's a beginning of something where you can keep. Is that something you recommend, Maxine and Dr. Fernandez?
Oh, I think it's a great idea. I think a lot of ways that you can keep track of things, it might be in your phone. You just take a quick note.
What are the things you think are important?
Well, certainly blood pressure for our transplant patients. We want to make sure that they're not having one early symptom of potentially having a rejection could be your blood pressure's going up. One symptom of you having like severe complications from having too much of your blood pressure medications is your blood pressure is too low. These sorts of things. And I've been feeling a little bit tired. Things like that will help.
So essentially a diary,
a notebook,
journal. Yeah, basically journal.
Yeah.
If you ate something weird and there was a weird reaction, you got to write it down because you may not remember to tell your Maxine about it later on.
Yeah, and if you just say, oh, I've been having a iffy stomach for the past few weeks, the doctor or the nurse will say, oh, okay. But what does that mean, right? But if you say I went to the bathroom 12 times every night for the past week, then, it's a different matter. Then it's a different matter. So I really recommend, I come from a background of I have 2 transplants, but I also have type 1 diabetes. I had type 1 diabetes. So in the diabetes world, it's so normal to keep a diary that I think it's a good thing for most people. Anyway.
And also keep your caregiver informed. Don't exclude people who care about you, because they will be the ones who help you the most, at the time when you need it. And also I'll add, because I think Karin mentioned earlier, it plays on your mind. If you need help, seek it, whether it's counselor, therapy. And if they want you to I was on Xanax for a while because I needed it to heal, so it's okay. I'm just saying, reach out.
Yeah.
Not only that, but I think having mental health support, particularly in the first year, is so important. As you said, Sam, with your caregivers, your family, and knowing when to reach out and ask your team for assistance, getting mental health assistance, because I think that it can sort of snowball on you and get harder to get help if you don't.
Is that something that at Columbia, and we do have a question here from a person at Columbia, do you have patient groups who meet? And, I wanted to respond to that patient.
That's we're actually trying to work on that. They have had some groups, I think, in the past in liver, We're working in the pediatric department to create an experience like that. Actually, we're trying to reach out to the young people so that they can help us develop that. I think that having support is very important from peers.
Peer support is strong, is very important, and if you're looking for a virtual way of doing so, TransplantLyfe is available, and there's good peer support. But if you want that hospital setting and finding another person who you can meet and maybe have a coffee with, that's of course wonderful if it could be arranged. And young people often have a way of getting it done, and it's good to see that, and maybe even the parents.
Yeah, and these days, the virtual option is definitely a good option. First of all, when you're sick, especially freshly transplanted, you don't want to be traveling, and you can't travel so much. So when you have a portal or something, use it. It'll help. There are virtual groups like that within, like TransplantLyfe and others.
So one of the topics on TransplantLyfe about complications that has been very active is just as you said, Dr. Fernandez, the complications from tacrolimus, and ranging from tremor, ranging from headaches and brain fog, memory loss. But then the most scary of all, and we had this conversation, Sam, just 2 days ago with our little group, right, was the risk of kidney failure. And how do we address that? And is that something that we can fix in some way?
So we're trying to, at the beginning of your transplant, the calcineurin inhibitors, tacrolimus, cyclosporin are great. We've seen that improvements in outcomes in terms of longevity for the allograft, the kidney allograft. Patients that have a heart transplant or liver transplant have seen native kidneys start to have side effects to the kidneys, not only our kidney transplant patients, because the side effect of this medication is some fibrosis over time. So what our strategy is to reduce the amount of damage over time. We reduce our goals for that medication over time. We switch from just being on a calcineurin inhibitor to maybe a combination of calcineurin inhibitor with another medication in order to still provide the level of prevention of rejection without losing that calcineurin inhibitor altogether. And then some people are switched off of it completely, depending on what's going on. There are some alternatives, not necessarily the first line, that we do try if a patient's able to tolerate them.
But it really, right now, there's not something that we can do with calcineurin inhibitors. They do eventually lead to scarring of the kidney, that even in minor degree or more of a higher extent. That's
right. I think that's why it's really important to make sure that you get your labs checked on a regular basis to try to help with that as much as possible. Again, it's not necessarily something that you're going to be able to prevent over time, but at least you'll have an idea of making sure those levels are never too high.
Right. Good, thank you. Anything, Maxine, again, when you say the reaching out, are you also from a nurse practitioner and the coordinator, are you reaching out to patients, or are you waiting for them to reach out to you? Is there an active outreach going the other way to those patients who may be a little shy?
Yes, so we do reach out to the patients as well. Each of us, we have, every patient is different, and, the timing. So we all set out time when we reach out to the patient. But again, we don't want them to wait
Right.
to hear from us. We want to actively hear from them if they need us. And another thing, what Sam mentioned is the support persons, to get them involved also. So as a support person, as a wife, a sibling, or whoever the support person may be, if you see something that's not right, you can reach out to us and let us know. And then we'll figure out how to reach out to the patient, to find out what's taking place. So, the support person should be very actively involved as well. And, feel free to reach out to us also.
Yep, no, that's really critical. And that support person could be a spouse, but it could also be a friend.
Yep.
Everybody.
Right? I mean, sometimes it's more comfortable having someone who may not be living with you and being the most emotionally connected, but someone who can be a little bit more objective. So that's fine too, in dedicating or designating a care partner.
Anyone.
Right? Yeah. How are you dealing with families? One of the big issues for transplant patients, of course, is family planning and complications. And Dr. Fernandez, being a pediatric as well as adult nephrologist, how do you take the person who is a pediatric transplant patient into adulthood, and how does that transition go when there's a period, even for those without transplants, where they may not be so communicative and a little bit rebellious?
So I think what we've developed is a transition clinic plan where we start to address these issues at the age of 16 for our young people in the pediatric setting, and having regularly scheduled visits that address these issues. How well does the adolescent know their medications, their disease process? How well do they partner with their parents? How well do they, and how do they feel about it? Are they ready to, when they turn 18, when they turn 20, are they ready to take on the responsibilities that their parents have been doing for them? That's a process that is going to be ongoing until they're 25. We have to be mindful of that it's not suddenly a switch that's going to turn on for anybody at a particular time. So our process is not only doing some evaluations of this with some different types of questions and instruments, but also we've involved a mental health professional who's a clinical psychologist, and we're actually developing further resources for our pediatric solid organ transplant team with additional psychologists to help across not only the transplant transition period, but also reaching back to when they're children, like when they're less than 5. We need to start this process early to assess for whatever needs these patients may have, so that it's not 16 when we start to talk about this, but earlier on. And again, preparing parents for those responsibilities that they're going to need to shift over to their children.
Yeah, and during that period, it's also a period of movement for young people. They may go to university, they may start a job that is not in their home. So having a hub like Columbia, where there's so many professionals and such a good system set up, ensuring that these patients, when they move to another part of the country where that may not be set up, must be kind of complicated.
It can be, and that there's a lot of anxiety about that too, making sure someone knows what I'm going to be. If it may be a matter of moving to, as you said, just college, and making sure that there's somebody that's identified there that will know what's going on with them, having a plan in place, and also knowing that they can call and suggest if they have concerns and they're getting information that they don't agree with or doesn't make sense to them.
Out of curiosity, Maxine, how often does it happen that a patient calls you on vacation? They are now in a different setup, in a different place, and they may not have their medication, or they've taken the medication the wrong time. And do you get a lot of calls from anxious patients who are traveling?
Not really that much, because I'm really on the pre-side of the program. So
I get those calls.
You get those calls.
So we have an on-call system, and we share all of those responsibilities. But yes, that's something that happens quite a bit.
I've been responsible.
I know what to do.
And it's great. I mean, that's why we have the support system, because you should feel as if you have a safety net 24 hours.
I think it's really important. It's really important because life continues when you have a transplant, and I think you do encourage that people eventually go back to somewhat normal life where they can travel and they don't have to be just locked to their home and never go out. But when you start in a setting that is not the normal, then there will be additional complications, and it's good to know that they can reach out.
Right.
Yeah, very, very good. We had another question here on night sweats. Is that a concern? Is that something that is?
Well, you should watch out for it. It's different. Right now everybody's sweating. But the concerns are, is this infectious? Is this as a result of some sort of malignancy? These are things that you should not ignore. and need to be addressed. It could be nothing. Some people are just sweaty at night, depending on the environment, but definitely not something to ignore.
Yeah, so it's an observandum or whatever we call it. All right, so it's not something to ignore. So if we are now, kind of concluding, some cardinal symptoms to think about. We heard diarrhea, weight loss. We heard night sweats, fatigue, brain fog or confusion.
Right.
Anything else?
Blood pressure and any pain, sudden pain.
Yeah.
Fever.
Blood pressure is kind of hard, right? If you don't measure it, so you have to have a routine.
Yeah, in that log, also record that, whatever it is, your vitals that you do at the hospital, you have to do some of those at home.
Yeah. So Sam, you do your vitals on a daily basis?
Yep.
That's good. That's
How do
great.
you keep track of them? Do you have it on paper or do you do it some other way?
So the blood pressure machine records it automatically, but I also use apps and things like that.
Mhm.
These days you can use your, iWatch or, all of that stuff is available. Plus, like, the TransplantLyfe does have the diary system. So you can record stuff, which is a start, and then you can build a log. Like for diabetes patients, we have those logs,
Yeah.
readings, and also there's a little comment section of what you ate and stuff like that, right? So it's all good to record stuff, and you might forget because of the brain fog. You're not healed completely, right?
Right. Weight, is that something you talked about? Weight loss, so weight is another.
Weight gain, like I was told, 5 pounds within a week is go get help, so.
Yeah, it's a heart transplant for sure, but also kidney, right, Dr. Fernandez?
We have a problem with that. Some people will come in being very poorly nourished on dialysis, and then after the fact, they feel fantastic and they start to eat. So obesity is an issue afterwards.
So
Yeah,
and that leads to
and also
diabetes.
I monitor my blood lab reports. I'm not a doctor, but I at least know what's the valid range. And if I don't see something right, I won't wait for the call. I'll call or use my portal to send a message. Is my potassium too high or whatever, So that's taking responsibility as a patient, You got to do those things because you guys, Maxine and Doctor, you're busy too.
Mhm.
So, and there's many patients like us, right? So
I want to ask that because Sam, you and I are the same. I always see my lab results probably before my poor doctor, Dr. Cohen, sees them, and then I text him or call him and say, "What about that creatinine?" He hasn't seen it yet, and maybe he gets a little irritated. But I mean, do you want us to reach out that way, or do you want to actually?
No,
You do?
I
Okay.
think it's great because, and it's funny you say that. Dr. Cohen's probably already seen the creatinine and is already thinking about what he's going to do about it.
Yeah, I'm sure.
But no, it's important because as you guys said, we're human. And if we miss something, we need to be aware of what's going on. And this is so important for you guys. So I think that's great.
So knowledge is power, and having power and understanding also makes you more in charge of your disease and makes you probably a better patient, if that is an expression. No one wants to be a patient, but since we're all patients and everyone is going to be patient at some point, it's good to be educated. Some final words to our audience. If anyone wants to volunteer, what's the most important thing here to prevent complications of transplant? We've heard some of the symptoms not to be ignored. We've also heard taking charge, being vigilant, not worrying about bothering your doctor or coordinator. They want to be bothered. Anything else we can leave to our
I mean, I definitely echo all of that. Plus, I want to say, feel empowered because that's going to save your life, actually prolong it. The transplant saved your life, but it'll prolong it if you pay attention to all of those things that Karin mentioned.
Go ahead.
No, communication is the key. I think that's the best thing that you can do is just be openly communicative with your team and your family, just like Sam said.
Wonderful. Well, thank you so much. Thank you for a great discussion. We could go on, but this is wonderful. I think we've given a lot of good advice. And please, as someone also asked in this chat, this is recorded. This will be archived. You can find it in its full length as well as a written version, and then there will be shorter videos as well. So thank you to all our members here today and to the audience, of course, and thank you to CSL Bering.
Thank you
Good
very
night.
much. Bye-bye.
Bye, guys.
Good night.